I'm Monda, and I've spent over a decade specializing in lymphatic drainage, particularly for clients recovering from cosmetic procedures. If you recently had a facelift, neck lift, or any facial cosmetic surgery, and you're wondering when is it safe to start lymphatic drainage, you're definitely not alone. It's one of the most common questions I get. The truth is, there's no one-size-fits-all answer. Some people can start within a few days post-op, while others may need to wait 2 to 4 weeks. It really depends on your surgeon's protocol and how your body is healing. So before starting any kind of lymphatic work, always check in with your doctor first. Once you're cleared, lymphatic drainage can help reduce swelling, relieve that tight or heavy feeling, and support a smoother, faster recovery. In today's video, I'm going to walk you through a gentle face and neck lymphatic drainage session. The same kind of work I do with my clients who want to look refreshed, feel better, and protect the results they've invested in. Let's get started. So, manual lymphatic drainage performed on somebody that has had a facial procedure. There are a few nuances to how we would proceed. We have to take into consideration that there will be an incision possibly here over the ear. So these lymphatic vessels will be, if not out of commission, significantly impaired in terms of the normal flow. And then also under the chin as well, there'll be a little bit of damage, if not removed. Some of the lymphatic vessels will be challenged as well. So we are going to go through those procedures, those techniques, considering the various nuances for the areas that are affected generally when we're doing or when there's a facial procedure. We're starting off with releasing the subclavian muscle, which is slightly below the collarbone, right? And again, we're pinning it and we rotate our head to the right. Rotating the head to the right. We started below the collarbone, doing a little bit of pulling. Now we're just doing a little bit of dragging above the collarbone. Light skin dragging. Right? And then we're going to pump. And this area is very important because the thoracic lymphatic duct drains from the left side, and that's 75% of the lymph is draining from the left side. So it's very important that we focus on the right side, we focus on the left side. And we're just doing some light circles, making sure that we open up this lymphatic duct. And then we'll do the same on the right side. Slight pulling above the collarbone. And you could just turn, if you like, to the left. And you feel a light pull. Do that maybe 4 times. And then rotate. Circular pumps on the right side. And then we will start pumping the lymph nodes right behind the ear. So again, we have the jawbone right here, and then we have our ear. Right below the ear is the mastoid process. The lymph node that we're accustomed to when we're sick is right here. We're just pumping. Circular pumps. You do about 10 of these. And then repeat on the opposite side. Circular pumps. Very gentle. Again, we're massaging the immune system, not the muscles. We may feel the tendency to, especially for those of us that like deep tissue massage, to want to apply a little bit more pressure, but that will defeat the process and cause the lymphatic vessels to spasm. All right, so that's area number 2. For women, we want to make sure that we're focused on really pumping the lymph nodes of the armpit. Right, so here we go, just pumping, circular motions, circular pump. Again, we're doing this maybe 10 times. If you find that one armpit is more swollen than the other, you may do it 15, 20 times. And again, on the opposite side. And then we want to get into directly impacting the thoracic duct. Okay, so we're just gonna go right down our sternum, not collarbone, but the sternum, breastbone. That's the lay term. Until you get into that little hollow where we're at the peak of our abdominal muscles, right? So we want to just come in here and we want to pump. But this area is a little bit more resilient, so we can do a deeper pump. And again, we want to do 10 to 15 pumps. 10 to 15 pumps. 10 to 15 pumps. So this is lymphatic duct number 4. I said subclavian node, but it's the subclavian duct. And we're pumping, and then we're going into the inguinal area. This is right in the hip crease. We're pumping, making sure that these are circular pumps in the hip. As we get into the lower extremities, they're a little bit more resilient, and we can apply a little bit more pressure there, nothing too much. Very mild, rhythmical, right? And again, we're doing about 10 to 15 pumps. So again, we're just pumping behind the knee crease at this point. Again, 10 to 15 pumps. And again, we're opening the drains before we start to sweep this fluid into these drains. It's very important that we follow this sequence, or we can cause congestion or just increase the flow of lymph. And the key thing is, what we want to do is not increase the flow of lymph, but increase lymph congestion. So we want to treat the congestion, we want to treat the lymphedema, the swelling. So it's very important that we follow this sequence where we're pumping the lymphatic ducts from the subclavian, behind the ear, the armpit, the stomach, the inguinal or pelvic region, and then we end with pumping the behind the knees, or the popliteal lymphatic duct. All right, so we've opened up the lymphatic ducts. Now we want to sweep the fluid, get rid of some of this congestion. So we're going to start off sweeping into the subclavian duct. So again, very light circular motions, sweeping into the collarbone region. And again, we want to do about maybe 10 of these. Flat surface of the hand, a little bit of skin dragging, right? And then we come to the opposite side. Again, circular motions, sweeping the fluid into the subclavian duct, right into the collarbone duct. So we can sweep with a drag, or if you like, you can do circular motions with an intention moving down towards the collarbone. Next, we'll work on the neck. We're going to use the live long and prosper hand gesture. We're going to turn it into like a wellness, a W. We're going to use this W to work on sweeping the lymphatic fluid from the ear downward, right? So always keeping skin contact with majority of the surface of the palm, making circular motions downward, right? We don't want to go up. Right, we're clearing the pathway because all we're going to drain from the center of the face outward, right? So we're going to go outward. We're not going to drain here. Everything is going to drain here. So we're going to start off bringing things to the side, but we want to just clear the path first of this major lymphatic vessel. And again, we're just making circular motions, coming down. And again, we're doing 10. And then we'll do the same on the opposite side, 10. Circular motions, making sure that we have full contact of the palm on the face. And the type of pressure we're using, imagine you're bringing a quarter or a dime across the table. That doesn't require a lot of pressure. So you could use that as your yardstick or your rule of thumb on how much pressure you're applying. And again, we're using 10 repetitions, 10 to 15. And then now we're just sweeping. Oftentimes there's incisions here, there's a lot of lymphedema here. And oftentimes we can't even feel our face. So we want to encourage the production or the regeneration of these damaged lymphatic ducts, vessels. So again, we just want to move the fluid from in and out, from center, lateral. We're going to start off right at the bottom of the neck, or pardon me, the bottom of the jaw. Just moving everything to the side. Again, about 10 times, and then opposite side, 10 times. And we're slightly below the jaw. Slightly below the jaw. 10 times. And then right above the jaw. And you can use both hands. Very gentle. Just lightly sweeping the fluid. You can even use both fingers. And then we want to pump some of the minor lymph nodes here. Right at the side of the mouth. Right slightly above the nostrils. 10 times. Very gentle. And then right at the edge, the inner edge of the eyebrows. 10 times, very gentle. And again, because we have the incisions here, we're gonna move the fluid in and out, but we wanna make sure that we don't focus too much here because we wanna bring everything down. So we're gonna spend more time inward, very little time outward, right? So again, we're starting here. Above the jawline, 10 times. And then oftentimes there's a lot of swelling in the cheek. We sometimes have fat deposits in the cheek. So we want to support the cheek. And we're doing little circles. Pushing the fluid, our circle. We're making a circle with a focus on bringing the fluid outward, away from the center line. Away from the center line. About 10, and then you move slightly to the left. Now we're going to go down. Circles with a downward intention. And we'll do the same, just using your finger pads lightly, circles right on the cheekbone. With an outward intention, doing that 10 times, and then slightly coming down, circle, rotations, and then we'll start with the forehead. And again, we could just sweep downward, very gentle. Very gentle, crescent shape, and some stationary. So again, we're going out with our circles, out with our circles, out with our circles, out with our circles. Again, we'll do that 10 times, and then we want to push the fluid down, right? So we're using our finger pads, circles with a downward intention, circles with a downward intention. And we'll do that 10 times at each station. So 10 times here, down, 10 times here, downward intention. We don't want to do the circle with that forward, that upward intention. We want to do circles with a downward intention. And it's good that we're sitting up because we're using gravity. We want to use the principle that fluid moves from an area of high pressure to an area of low pressure, which is right here. And then we're also using that concentration gradient of gravity, making sure gravity is on our side to drain the face. So let us continue. And now that we've drained the face from in and out, again, if you notice that there's more swelling here, we may want to go a little bit on the eye, slightly below the eyebrow, circular motions with an intention outward. You'll spend a little bit more time there. If you notice you have more swelling slightly below the eye, like myself, we're going to spend a little bit of time here. Right? So we may do about maybe 15 to 20 circular motions. And then once we've drained the face, we want to reroute things back down here. So we may push things back here, push the fluid back to the corner. Do the opposite side, push the fluid back. And then drain downward, drain downward, or sweep downward, downward towards the collar. You're doing 10 to 15 strokes. So we can do strokes, or we can do, again, circular downward movements. Circular downward movements. And then we end with some deep diaphragmatic breathing.